Welcome back to our channel. In patients with atrial fibrillation who are unsuitable for vitamin K antagonist therapy, Apixaban significantly reduces the risk of stroke and systemic embolism without increasing major bleeding or intracranial hemorrhage compared to aspirin. This finding is crucial for those who cannot tolerate traditional anticoagulants, offering a safer and more effective alternative. Vitamin K antagonists, such as warfarin, have long been the standard for preventing stroke in patients with atrial fibrillation. However, VKAs require regular monitoring and can interact with many medications, leading to complications. For patients unable to tolerate VKAs, aspirin has been an alternative, though it's less effective in preventing thromboembolic events. This has left a significant gap in effective treatment options for these patients. Apixaban, a newer anticoagulant, offers a promising alternative due to fewer interactions and no need for regular INR monitoring. The AVERROES trial investigated the efficacy of Apixaban compared to aspirin in atrial fibrillation patients unsuitable for VKAs. This trial aimed to provide a clearer understanding of whether Apixaban could fill the treatment gap left by VKAs and aspirin. The 2011 AVERROES trial randomized 5,599 patients with atrial fibrillation who could not take VKAs to receive either Apixaban or aspirin. The trial ended early due to clear benefits from Apixaban. Over an average follow-up of 1.1 years, Apixaban showed a lower rate of stroke or systemic embolism compared to aspirin. This early termination highlighted the significant advantages of Apixaban over aspirin, prompting further investigation and validation. The results were compelling. Apixaban had a stroke or systemic embolism rate of 1.6% per year, compared to 3.7% per year for aspirin. Major bleeding rates were similar between the Apixaban and aspirin groups, at 1.4% and 1.2% per year, respectively. This demonstrated that Apixaban did not increase the risk of major bleeding, making it a safer option for patients. The Aristotle trial, also published in 2011, further confirmed Apixaban's superiority over VKAs in reducing stroke or systemic embolism, with a lower bleeding risk compared to warfarin. This additional evidence solidified Apixaban's role as a leading anticoagulant for atrial fibrillation patients. According to the 2014 guidelines from the American Heart Association, American College of Cardiology, and Heart Rhythm Society, for patients with non-valvular atrial fibrillation and a prior stroke, transient ischemic attack, or a CHA2DS2 VASC score of 2 or higher, oral anticoagulation is recommended, including Apixaban. For those unable to maintain an INR of 2 to 3 with warfarin, Apixaban is suggested as an alternative. The AVERROES trial was a multi-center, double-blind, randomized, placebo-controlled trial. It included 5,599 patients with atrial fibrillation unsuitable for VKA therapy. Participants were divided into two groups. 2,808 received Apixaban, and 2,791 received aspirin. The mean follow-up duration was 1.1 years, providing a substantial period to observe the outcomes. The primary outcomes measured were the effectiveness in preventing stroke or systemic embolism and the safety in terms of major bleeding. Apixaban showed a stroke or systemic embolism rate of 1.6% per year, compared to 3.7% per year for aspirin. Major bleeding rates were similar, with 1.4% per year for Apixaban and 1.2% per year for aspirin. Critics noted that the early termination of the trial might have inflated the perceived benefit of Apixaban. Additionally, the dosage of aspirin used was mostly 162 milligrams or less, leaving uncertainty for those using higher doses. The trial was funded by Bristol Myers Squibb and Pfizer, the makers of Apixaban, also known as Eliquis. Thanks for joining us today. If you found this video helpful, give it a thumbs up and subscribe for more updates. See you next time.